Thank you. All right, Tony.
Well, first of all, I want to thank you guys for allowing me the opportunity to share some information with you about your foot health, because your foot health not only starts as your foundation, but it's something that should be treasured, because if the big guy could wash feet, we can talk about feet.
Yeah.
So, with that being said, I'm gonna talk about a couple of the most common things that we see, and it's some of the things that you guys have witnessed. But at the end, I'm gonna give you some solutions to all of these problems, some universal foot health daily duties. One, we always see people talk about their arches and heels hurting. And plantar fasciitis is what it's called. It's one of the most common problems I see in my practice. And it goes from athletes to the Sturdivant power workout, where they really get pretty involved, where they do a little extra walking, which we don't need extra anything. But it causes this particular problem in your heels and your feet. Aside from the fact that wearing proper fitted shoes helps to decrease any other subtle problems like calluses and corns. So, what that leads me to is you've seen some of the patients or some of your relatives with the big bumps on the side of their foot. And what these bumps are, they're called bunions. And the medical name for it is hallux abductovalgus. So when you develop these bunions, one, they're genetic. Two, they can be exercise induced. Three, they can be trauma induced. Four, ill proper fitting shoes causes, again, a lot of problems. The next particular diagnoses that I see in my practice are hammer toes. And if everybody saw that movie, Hammer Time, sometimes we develop a little hammer time. And that's where our toes tend to curl and grip the ground so that it can stabilize us. But what happens over time, the toes tend to contract and it causes them to rise up, rubbing the bones on the tops of the shoes, which causes the calluses. And everybody goes, "Can you just cut my calluses out?" Well, you can debride them, smooth them down with a pumice stone, with an emery board, and put emollients on them, i.e., shea butter, coconut oil. I don't like using Vaseline a lot, but we as people of color love Vaseline. So that's something that's really, really good to use lightly. But using Absorbase, Amlactin cream, which you've seen over the counters in Walmart and Walgreens, those particular products really help in moisturizing your feet and your legs. What happens next, and some of the things that we see, is pain across the balls of your feet. And that's where your digits connect to the balls. And what happens with ladies, because in the past they've worn these stiletto shoes, which lifts the heel up but forces the metatarsal heads to the sole of the midfoot, which causes some calluses, but it also causes the fat pads in the bottoms of your feet to shift forward. And when it does that, it thins those fat pads out so you feel as though you're walking on little marbles. From the first metatarsal head, where the big toe is, to the second, third, fourth, and fifth mets, where your toes communicate with your metatarsal heads, or commonly called the balls of your feet. One of the ways to prevent this from really being a deterrent in your daily living activities is that we stress using inserts. So when we put an insert in your shoe, whenever you're doing any type of physical activity, workouts, you need a more accommodating insert. So you need an insert that's soft, like a Spinco, or you see the Dr. Scholl's over the counter spongy. or when you look at Skechers and they talk about the memory foam inserts can be ordered off of Amazon. And I've shared it with a couple of patients today, and they run about $15. Now, when I talk about the inserts, it always makes one think about going to the Good Foot store. I don't have anything against that, but what the Good Foot store does, it accommodates people who really don't have insurance so that they could get an insert made or get an insert that's an over the counter insert with different properties to support a foot type. So when I say support a foot type, what we talk about is people with really flat feet, which we see that more in the brown community, versus really high arched feet, as we see in the European community. So what happens when you have a really flat foot, you usually see this bulge on the medial aspect or the inside aspect of your foot where it takes a lot of pressure. Well, what happens with that, you develop another tendonitis called posterior tibial tendonitis, which is a flare that happens because the foot puts so much medial pressure on the inside until it causes that tendon to be thinned. It causes the peritoneum to be scarred. And that's the tendon that's around the tendon that feeds the blood flow to the tendon. So when that gets disrupted, it causes other problems where you get increased discomfort and pain at a pinpoint point or a pinpoint pressure point on that medial aspect of your foot. So to compensate, you walk more on the outside, causing the peroneal tendons or the outside tendons to become inflamed. So you go and you say, well, I've changed the way that I walk, but now I'm experiencing another problem in another place. Well, your body compensates, but it can compensate again with a transferred tendonitis or a transferred overuse problem. Now, we know that whenever you talk about tendons, we talk about how that foot functions in the gait or the walking or the activity of a jog. So when the tendons get stressed or strained, it causes inflammation. So with this inflammation, this is when we need things like a topical Voltaren gel, turmeric spice. I'm so holistic when I want everyone to consider using topicals versus pills that one, you have to swallow, it goes down your esophagus. If we have any kind of hiatal hernia, it could aggravate that. It goes to our stomach where it sits and gets broken down, which can cause the H2 blocker medications to be ineffective. So it causes gastric problems or gastric peptic ulcers. So then it travels to the small intestines, to the large intestines, where as it goes through each of these different organs, different chemical content that our body has to break down our foodstuffs and medication, it is the same process. So if it's sitting in your gut, again, that's where we start to develop the colitis. So this whole foot process and this rehab process can be a concomitant effect where it's affecting other organs. Now, what everybody talks about these days is diabetes. And we talk about the diabetic foot. And with the diabetic foot comes a thing called a neurotrophic arthropathy. Oh, I get to say that big word. I didn't know I could do it, Miss Duffin, but I did it. I did it. So we talk about, you hear it on TV all the time, neuropathy, burning, tingling, ant bites. It feels as though you have little chiggers on your feet or on your legs. So what happens with this diabetes is such a multi-system disease that When these foodstuffs that we eat turn into carbohydrates, the carbos are what causes your diabetes to become more than what it is. Your brain loves glucose. So without our brain being able to control the functions, with glucose, that's a plus. But the body is so unbelievable that we need that glucose to go into our systems, into our bloodstream, so that it opens up the doors so that the insulin can come out of our pancreas. So when the insulin is released, it gets in our bloodstream, but it goes to our eyes, to our muscles, to our tongue, to our teeth, to our sweat glands, to our paras, paresthesis. So it goes to the gut. We need it for our heart. We need it for our nerves. We need it for the arteries. But when you get the glucose that's in the bloodstream, it's like a piece of candy on your teeth. So say you eat candy, eat candy, and you notice that the enamel wastes and it gets broken down and it gets open, and then you develop a cavity where the same thing happens in your bloodstream. So when the glucose is steady going through your bloodstream and your nerves, it's eating away all of the fibers. It's eating away all of the tissue that protects things in your bloodstream to go normal. So then what you start experiencing is increased thirstiness. You start experiencing dysphagia, where you feel as though when you eat, as soon as you get up, you need to eat again because that glucose is just circulating in your system and it's not getting to your muscles. It's not getting to your heart. It's not getting to your lungs. It's not getting to your kidneys. It's not getting to your liver. It's not getting to your appendix. It's not getting to your leg muscles. It's not getting to your eyes. So your olfaction. So a lot of things change. So it tends to break down your immune system. And with the breakdown of your immune system, that causes other subtle problems that exist that you did not know exist. So that's why it's so important to do your checkups, to do your monthlies, to do your every 3 month, to do your every 6 month appointment so that you can stay on top of these things. Now, with diabetes and the neuropathy, you see that a lot of patients are on a lot of medications, Lyrica, gabapentin, um, Neurontin, Cymbalta. So there's a whole list of these medicines that are really good for the neuropathy, but they cause other concomitant effects like lightheadedness, dizziness. So then what happens with the lightheadedness and the dizziness, you think you're fine. You step up between the halftime of the football game, walk to the bathroom, and the next thing you know, you've gotten dizzy or lightheaded, and boom, you've fallen. And these falls can lead to other catastrophic events: fractured hips, knee replacements, knee surgery, fractured ankles. So being careful with these medications and not abusing them is so very important. One of the medications that I think is just wonderful is B12. So when you take a B12, nerves love B12. So it helps the nerve function a little bit more efficiently. When you talk about um, the nerves interacting, the nerves have to stimulate the muscle, which stimulates the tendon, which causes the tendon to move the bone so that the bone functions so that you can walk, or you can jog, or you can run, or you can jump. So B12 is one of my most favorite drugs that is over the counter, that's water soluble, and it also helps boost your immune system. So when we talk about your immune system, we're talking about our susceptibility to the environments on the outside. And the biggest COVID that they have made a COVID is COVID. So we always want to watch out for that. We always want to watch out for the flu. We always want to watch out for the seasonal allergies because, again, that is our immune system. So my big thing with that is local honey. If you can get local honey, it helps boost your immune system to your community and to your environment of the plants and foodstuffs that we eat. So this leads me to, and Lisa, let me know if I need to speed up or shut it down. But it leads me to this thing called peripheral vascular disease, or PVD, or peripheral artery disease, PAD. So once the nerve starts getting involved, once the muscles start getting weak, you start developing these little plaques in your coronary arteries, but the same plaques you develop in your lower extremity, where you get decreased blood flow from your big arteries. So when this starts happening, we have to tag team with vascular, and this is when you have all of your bypasses. We have to tag team with cardio because this when you have to get coronary artery stenting. So if that heart is not putting out good blood flow, and as it gets to your lower extremities, the arteries get a little smaller. Your femoral artery is huge. It's about the size of a distal celery stick in most of us. But because it's surrounded by muscle, it's surrounded by adipose or fat, this thing really protects that artery so that that thing can bring a lot of good blood flow to your lower extremity and
Tony,
your upper extremity. Yes,
tell us
ma'am.
where the femoral artery is and how important it is. Some of us may not know.
Well, the femoral artery is in your thigh. And if you've seen any of these movies these days, you always see the kung fu guys when they have the little knives. You always see somebody stroke across the insides of their legs. Well, what happens with this, me being in the military in hand-to-hand combat, that's one of the strike points that we have that is so accessible when you're being threatened by someone. If you happen to have that knife, you hit the medial aspect of their thighs, and when you hit that artery, it takes a matter of seconds, a matter of minutes before they get lightheaded, get dizzy, and you bleed out. So this thing really brings a lot of good blood flow to the dorsal, and that which is the top of your thigh, and the posterior or the back of your thigh, so that your thighs can be more effective. Now, as it goes to your leg or your tibia and your fibula, what ends up happening is these arteries reduce by half, but they are still very, very important in bringing blood flow to your lower extremities. So you've always seen your great great grandmother or your great great aunt when she gets the dark toes and you get the discoloration. So when you see the dark toes, that means that your body is trying to change its content because of trauma over the years, because of scar tissue over the years, because of arthritis over the years, where you don't get the blood flow that you had when you were 22. So you notice the skin changes, which are called trophic skin changes, where you see colleagues, family members lose their toes. Now, you don't have to be 80, you don't have to be 90 for this to have an effect, because we saw Deion Sanders, who's one of the biggest icons right now, undergo multiple amputations at his feet due to his circulation problems, due to his arthritic changes, due to his multiple surgeries that were done on his feet, which developed scar tissue. So what we need to be really aware of is being aware of that circulation and things that we need to do in order to keep that going in a good way. And of course, when I say circulation, I have to get into the smoking aspect and the food aspect. If you smoke one cigarette, it shuts down your arteries by 55%. So in order for that artery to recover, it takes 55 minutes. So, example, you smoke a cigarette and it shuts down your artery 55%. So that's less than half. So for that artery to recover, it takes 50 minutes. So say at, and obviously you see this when people that smoke, They don't smoke one cigarette when they're out. They'll smoke another cigarette before 60 minutes is up. So that means that that artery went down 55% in diameter, which means that it never got back to 100. It may have gotten back to 60, but 55% in diameter to 60 leaves 15% of that artery functioning. So now that thing is functioning at 15%. So it takes another 45 minutes, 55 minutes for it to recover. So by the time you get from minute, we're going to say minute 20, that 16% has only opened back up to 30 to 32%. So it's still low. So you smoke again before that 55 minutes are up, that 16% goes to 8%. So each time you are decreasing the function of that artery to bring efficient blood flow to your lower extremities, to your upper extremities, and it overworks your heart. So what we have to do is be as mindful with the foodstuffs we eat. So foods that are high in fat, those wonderful ribs at Baby Back Applebee's, those pork loins, that porterhouse, all of those foodstuffs, the excess candy, the cakes, these things can do as much damage as smoking when they are not controlled. So your diet is such an important part, and nutrition is such an important part in your overall health. And when we talk about this, nutrition, milk thistle, vitamin B, vitamin D, vitamin. Well, I like a lot of supplements, and I'm trying not to get too deep with the supplements, but ginger root, milk thistle, all of these different types of vitamins are really, really good for your kidneys and your liver. And everything gets detoxified through your liver, and everything passes through your kidneys. So that's why they are so important. And that's why we need to take care of those particular organs, because they're the lifelong and the life set organs. You've always seen your friends go on dialysis, kidney failure. You've seen your friends have heart transplants, important. You've seen your friends have kidney transplants, important. You can't function without them. Now, with that being said, first, I know I probably went through a lot of things for you guys. And I hope that I didn't get too technical, but technical enough where you understand the importance of doing this overall health. And just coming from your feet, we've talked about a whole system of, or a whole plethora of diseases and ways that we need to attack things through your feet. And I know some of you guys are familiar with reflexology. That's for another topic, but it's true. Things through your body go through massage. So if anybody has any questions for me, I'd be more than happy to answer anything.
Tony, thank you. I know there are questions. You gave us a lot to think about. So I'm going to kick it off because the first thing I heard and wanted to interrupt was insoles when you exercise. So we spend a lot of money on these athletic shoes these
Yes.
days. Are you suggesting that we put insoles in our athletic shoes as well as
Yeah.
those?
Yes. And what I like for each of you guys to do is to use an insert called a plastizote. It's PLASTIZOTE. And these plastizote insoles are the insoles that we use in diabetics. And they're really, really soft. They're like memory foam. It's like the memory foam that you use in Skechers. That's what made Skechers such a great shoe, because it started to accommodate.
Could that be put in the chat so that I can get that spelling?
Yes.
Thank
Mm-hmm. I'm doing it. Okay.
So the other thing is you hear, and I'm a real big advocate of orthotics, and custom made orthotics are really, really good. They're not for everybody. So when I say this, when somebody has an extremely, extremely flat foot and you get a graphite type insert that's made that you need to wear day to day to try to change the structure of that foot, sometimes it's not really, really supportive because the graphite, which is really light and is semi-flexible, what that does, it can cause some uncomfortable feelings in that arch to get used to any type of insert that is more therapeutic. So when I say therapeutic, I'm talking about a custom made insert where they take a mold of your foot, they pour it into the cast, and they make a positive cast out of the negative cast, which was formed by your foot. And it's the same thing that they do in Hollywood when they do a mold for um, the Wax Museum for like Michael Jackson, and he looks just like himself. Or you look at Genghis Khan, and you say the details in this thing is pretty awesome. So they do the same thing for your feet for inserts. And when I say that, I would recommend people not work out in a hard insert, but they would work out with a more accommodative insert, like a Plastizote or a Spinco or a Sketcher type memory foam insert.
Carissa, I see your hand. Is that for the insert or another question?
It's similar to the question that you raised. My doctor has given me an order to go, I think it's Fleet Feet,
Yes,
and be fit for the right shoe.
correct.
And so I plan to do that tomorrow. But when you mentioned that about the insole, I mean, I'm just going to buy one pair of shoes. Um, but with this insole, it sounds like that's something that may help me in other shoes that I'm wearing. Um, I can't speak on what they're going to recommend. I've had this done before, so I'm interested to see what this place will say
Well,
about what to do.
well, if I can, just to give you a little bit of information,
I would love to
Fleet
have it.
Fleetfoot is a great store, and they're used to people coming in that are pretty serious runners, pretty active hikers because they have the hiking boot or the hiking shoe, and they know that you have a captive audience when, and I don't want to say the dog and pony show, but when they decide that they want to um, fit you for an insert. One of the things that I want you to be aware of is that I think they do a great job of fitting you for a shoe.
Right.
So you can leave with that information because technically, whenever you get a shoe, you want to have your thumb press down on the front of the shoe and have a distance from your longest toe to the end of the shoe, a thumb length. So that's one of the things. And they're pretty good about that. The other thing is what they do is they measure the length of your foot and the width of your foot. So they are excellent in shoe fitting. So whatever size they have, it doesn't matter about the size because if a shoe is made and you see on the back of sneakers, it says Japan, US, Britain, China. So the last of the shoes are made differently. That's why a Brooks may feel one way, and an Asics and an Adidas and a Nike and a New Balance shoe will fit you differently. But it says it's the same size. But when they do the last in Europe and in Japan and in China, what the last is how they fit that shoe to make the shoe size. So it's usually smaller. So it's not the same
Okay.
as an American size shoe when you look at the last. So it's not so important that you get the size of the shoe, it's that you get the fit of the shoe so that you
Correct.
recognize how it does when you put your thumb at the end, when you recognize how you feel it on the sides of your feet. So what they do is a great job of sizing you up for your shoe. And that's what you want. Now, the
And
next
that's
thing
what I'm
I'm gonna
going for is
so
the
that's what,
sizing.
yes, and that's what I'm gonna share. I don't want you to get caught up and buy $165 shoe because 3 months later that
You
shoe is
say
gonna
you
be
would.
$100. 3 months later that shoe is gonna be $60, and then 3 months later that same shoe is gonna be $40 to $50. So you don't want to get caught up in that. But once you get that shoe sized and you understand how to fit it, and this is nothing to Belks, but Belks always has New Balance or um uh I want to say Mizuno's. They always have, it's not an off-brand shoe, but they always have different running shoes in there that you just got fitted for at Fleet Feet for an Adidas or a Sequoia or a Nike or an Adidas
Hmm.
or I mean a New Balance or whatever shoe. And you can get that same shoe
Okay.
for one half the price that they had that shoe at Fleetfoot because they have a captive audience where they have all of the runners, the people that want to be runners, the joggers. We're not trying to run marathons. We just want to get sized for a good shoe. So my take home with that is let them size you up, measure it. If they have a good sale going on and something is good that you like, get it. But if they got a new shoe out and they telling you this is the greatest and the most comfortable shoe that you will
Yeah.
ever wear with the best support, you can leave that.
Thank you. That's the least of your words. I'm going for the fitting, but I
Yes,
wanted your
ma'am.
advice on it. Thank you.
Um, thumb this way. When you, okay,
From the
put your,
end.
okay. All right. Everybody saw that? Right way to do the thumb?
Mhm.
Right at
Okay.
the end.
Okay. We have no excuses now to know how much distance we need. Okay. There are a couple of questions in the chat. The first is, um, why is Vaseline not good for you? I mean, why did you say less Vaseline and you move toward the shea butter or whatever, you know?
Well, what you want to use is like a material that's called whipped petroleum. So when they make the petroleum, they put air in it. So when you put it on your foot, such as absorbase, such as cocoa butter, shea butter, when you put that on, it gives that skin a chance to breathe. But it also helps that emollient to melt into your skin via the porousness that's in your skin naturally. The sweat glands that open up so that you can sweat, the sweat glands that close down so it keeps you really from sweating, to keep you a little warmer. When you use Vaseline, it's not whipped. And you know when you put it on, it's really, really oily. So what that does, it clogs up your sweat glands. So you use it every day and you notice that your feet get slick and then they get kind of a little crackly. And when it clogs up the sweat glands, a lot of debris gets in the Vaseline. You've seen it, like if you put your Vaseline on and then you take your sock off, and if you were working leaves outside, you could find all of the little shards of leaves on your feet. It's like stuck in those pores. And we don't want that. But Vaseline is good for some things,
Mhm.
but I just don't think it's the most appropriate thing for moisturization. Now, my great grandmother used it and her feet were so nice, but she was so clean. So, she really paid attention to what was going on. So, I would recommend, because it is the millennium, that we use a different kind of hydrating cream. So it's more like an emollient.
Okay. Another question. You mentioned that the plastizote is found in Skechers.
Yes, it's a
So
memory
if
foam, but
so
but you can get them from Amazon when you go
if you
online.
but if you wear Skechers, do you need an insole too?
No,
Okay.
because they have it in there, which made that shoe so wonderfully well. You remember when Skechers came out? That was the ugliest shoe ever, and it was really reasonably priced. Skechers cost $130 now,
Mm-hmm. Yes. Yeah.
and they
Yeah, they
hadn't
do.
changed much, but the
They're
style a
very
little bit.
comfortable, but they have gone up sky high.
All right, I'm through with the chat. Are there other questions to be asked? He talked about PAD, which is something that's huge among African Americans. Disproportionately, we are affected for the reasons that Tony mentioned. Some of it is, the diet and what we eat, but then there's still the smoking and the other things he talked about. So, any additional questions about our feet?
What about plantar fasciitis?
Oh, more about it. He talked about it. What you want to know about it?
What
How do you
causes
treat it?
it?
How can you fix it?
Right.
Okay.
Okay.
Well, one of the most important things that you as an individual need to recognize is that if you have plantar fasciitis, it's an injury. So it's some type of injury, whether it was traumatically induced acutely or whether it happened over time. And because I'm in South Carolina, we have a lot of manufacturing and it's a right to work state. So they can work everybody for 10 days straight, 14 hours a day. You can't do anything 14 hours a day for 10 to 20, 10 to 15 days on concrete surfaces, on ladders, on forklifts where you're standing. So you develop this inflammation, which causes a heel spur, and heel spur and plantar fasciitis are one and the same. You hear people say, I got spurs. Well, that's the same thing as plantar fasciitis because you can develop plantar fasciitis without a spur, and it's called an enthesiopathy. It's just a big word for arthritis between a tendon and a bone versus arthritis between two joints in a bone, where it's bone on bone. Well, the way you treat it is if your stomach is able to take it, is take 800 milligrams of Motrin 3 times a day,
Mm.
use an ice massage therapy. You take a water bottle, put water in it, freeze it, put it in a Ziploc bag. You put it in a Ziploc bag, and this is for the men because the wives go, you're not putting that thing you rolled your feet on in my refrigerator. So you wipe it down with alcohol, put it in a bag, and then freeze it again. Then take it out, roll it in your arches. No pain is bad gain. So you do it to resistance. You never do anything to make it cause discomfort. You can take a little tennis ball, which is very soft, roll it in your arches while you're looking at a movie, like you would do the water and ice. You can also use, my big thing now is these heating pads with infrared light. And you don't need to go out and get the most expensive pad. I saw one on Amazon when I was sharing it with my patient for like $60. And you can use the pads on your knees, on your back, on your shoulder, on your hip. So it's a good universal piece of therapeutic device that can be really beneficial for a lot of different things. And infrared helps decrease inflammation. It helps increase your immune system, which that's what we need to be so aware of with our foodstuffs and our activity because people sneeze, germs in the air, people cough, germs in the air, people sweat, germs are in the air. So I hope that answered the plantar fasciitis question. So it's ice therapy, stretching, tennis ball, no stretching to pain, only to resistance. Everything is to resistance.
Very good. Belinda, your hand is raised.
Yes, and I'm not sure if I missed it. I came in a few minutes late. But Lisa, last month, when you kind of gave us a pre-introduction to this, you mentioned something about not wearing the same shoes 2 days in a row. Did Tony by chance address that, or did I miss it?
I didn't ask him to, but
Okay,
I
okay,
didn't ask him to, but
okay.
that's what a podiatrist told me. Don't wear the same shoe 2 days in a row.
I have to agree with what was said with that because I think you should have a shoe in the workspace. I think you should have a shoe that you work out in that's specifically for workouts. And then you have your everyday shoes. So when I go into the office, and of course I got several pair of shoes, but The shoes that I have in the office stay in the office. So when I leave out, even to go get lunch or go to the hospital, I change and put my shoes that I wore into work on, leaving my work shoe at my desk, and then go to the hospital, do what I need to do. And most of the time, if I'm at the surgery center, I have my clogs that I wear doing surgery. So again, I'm changing another shoe for support for what the duty is of the day. So, example, if you're playing soccer, you need soccer cleats. If you're playing baseball, you need baseball cleats. If you are running track, you need track spikes. If you're playing football, you need football cleats. So that's the philosophy that you need to take because your feet are so important. We take them for granted. You know, we get the calluses, we don't take an emery board and shave them down. We don't put the emollients on them. So it's just little things that we can do to protect our feet so that they can have longevity. Because we're on them 90% of the time.
So does that exclude us doing like our day-to-day activities? If I've got a pair of sneakers on today that I just wear around, I should not be wearing the same sneakers tomorrow. I should be doing a different type of shoe if I'm just running around.
Yes, that would be ideal. But I'm sure you guys have a lot of tennis shoes. Because, there's a lot of style in St. Peter.
Hey, Lisa,
Yeah, yes,
my
yes.
my question is, if you're a walker, how often do you need to change your sneakers? Someone told me you shouldn't, after 6 months, you should not use the sneaker.
Exactly. My philosophy is if you walking 3 to 5 miles every day, at the 90-mile mark, the 100-mile mark, you need to be changing shoes. So you can do the math. So if you walk 5 days a week, 3 miles a day, 3 times 5 is 15.
Right.
So, you know, you just extrapolate that out and you can see that, hey, I've worn these shoes for a year. Now you need to look to see if the heel counter is breaking down and the inside of the shoe is breaking down. Did the heel get sunken in? Can you see the imprints of the balls of your feet? Like when you take the little insert out?
Right.
So you can see where the pressure points are. And that's what they do at a good foot store. Or that's what they do on these machines with the Dr. Scholl's. So it marks where you have hot spots on your feet. So that's when you need to interchange those insoles. So some people are a little lighter on their feet than others. That's not the telltale sign for everybody. Some people, if they're running, they may need to change their shoes every 4 months. Some may be able to extrapolate it out to 7 or 8 or 9 months. But when you see that the contour of the shoe breakdown, that's going to start causing other overuse problems.
Evelyn, we know how
Thank you.
much you walk, so you better start getting your shoes more frequently, girl.
No, Lisa, I try to.
That's for sure.
So Walter said, disclaimer, we're not trying to get people to buy more shoes, but Evelyn, in your case, you may have to.
Yeah, I know, Lisa. I've been trying to do the right thing.
You are.
Yeah.
I know you are.
Well, can I ask you how far you walk a day
Well,
for your exercise?
I usually walk 2 miles.
Good.
I used to walk 3.
Good.
But,
2 miles is perfect.
I'm older now, so I've slowed down a little bit.
Oh,
Barely.
what you mean? What you mean? You're 36?
Right.
There you go.
No. But
This
yeah,
is great.
that's what I do. And we walk 3 miles, 2 miles, 3 days a week. I use my sneakers for line dance and for exercise.
Now, I would suggest when you line dance, you go to that class twice a week.
Yes.
Mhm.
So I know I hear this all the time. And in that class, y'all get all excited because y'all get a little long. The line dance should be like 30 minutes, but y'all end up spending an hour in that line dance class because y'all get all.
Yeah,
So,
we do an hour.
yeah. So I think that you should have a specific shoe for that activity. A running shoe.
Wow. Running
Wow.
shoe?
Uh-oh, Walter, he's
Um,
he's stepping in somebody's wallets.
you got that right.
But the beautiful thing is, you can find these shoes because I know you ladies go. Y'all know my mama Lois. She can find anything in Williamsburg,
Mm.
so she can find anything in Richmond.
Yeah.
She can find anything in South Carolina when she came down here. I was like, where you get that from? Well, I bought you 5 pair of these Adidas golf pants, and I only paid $2.50 a piece. I was like, Mom, these things cost $90. How you get that? But Lois.
Yes. Yes.
Mhm.
Those are great suggestions. I mean, because if you are an hour in the same shoe every, I mean, at least you get a break because it's not continuously 5 days a week.
Right.
It's Monday, Wednesday, and Friday. So you put those down, but you know.
Look, let me give you an example. I used to be, unfortunately, I did a sports medicine fellowship. So with the Padres and the Chargers and the USA volleyball team and um, San Diego State University. So I used to see a bunch of athletes, and they really, and you need to treat your body like these athletes. And me being an old dumb jock, I understood that. And at that next level, where I was fortunate enough to be able to get to that next level, it takes a lot of conditioning. And the conditioning is, you got to take care of your feet. You got to take care of your legs. You got to do your stretching, your range of motion. Your core is so important. So if everybody would focus on core when you stretch versus pounding, that makes all the difference in the world. So your philosophy should be to work out to resistance, not to pain. So you're not going to the Olympics. You're not going to the NBA finals. What we're doing is trying to gain longevity through exercise. And we want to do it smartly so that we don't develop an overuse problem. And I had a patient that come in today. This guy's a little petite guy. I mean, he's not big as a nothing. So he comes in, and this would be devastating to you guys. So he comes in and he fractured his wrist. So when he fractured his wrist, he had to be immobilized. So when he was immobilized, he couldn't lift. But I'm looking at this guy and I'm like, he may be 5'5", and he may weigh 120 pounds. But he said he was lifting. So he got back into the lifting, did the lifting, and he was doing some squats. So we had to figure out what caused this problem. Well, he's got a drop foot, which means that when he walks, his foot flaps, his toes drag, so he doesn't get swing phase clearance with his tibialis anterior tendon. So when he fires this tendon, it doesn't work. So he has to pick his knee up and flop his foot down. Well, this guy's 25 years old and he's got a drop foot. So we get to talking. He goes, I was doing toe raises. So when I was doing these toe raises, I said, did you hear a pop? Did you hear something like this? He goes, no. But when I was feeling both of his tendons, one of them looked like it was way thinner than the other. So at some point in time, he ruptured his tendon while doing some little dumbbell toe raises. So it happened that fast. And he came to see me. It hadn't been a month when I got him in. So, we had to do some x-rays. So he goes, I don't know if we really need x-rays. So we needed x-rays so I could see if the tendon rolled up. So I said, we're going to schedule MRI. So we're going to get an MRI, which is going to really show where he ruptured that tendon. Or you see it where that anterior tibial nerve gets traumatized during back surgery. You see it a lot in lower back surgery. But that's one of the things that happens when people have a stroke. Again, you get a drop foot. That's one of the things that happens when somebody's diabetes is out of control and they start to develop this neuropathy, which the neuropathy doesn't allow the nerve to communicate with the tendon. So that thing freezes and it doesn't react. So you develop another drop foot from this thing. And aside from that, whenever someone has any type of palsy, any type of autoimmune disease, any type of neurological deficit, whether it be brain trauma, whether it be CVA, whether it be trauma was idiopathic caused by surgery, whether it comes from the nerve being traumatized because the back has developed some type of degenerative joint change, which closes down the canal, which causes the bone to rub on the nerve, which shards the nerve, and it never functions like it did before it got the shard effect. So again, that's from your feet to a stroke, to your brain, to trauma through overuse.
Mm. There's one question in the chat I don't want to overlook, and that question was, share, even though you didn't want to get into natural remedies, let's go with explanation of the milk thistle and ginger root. You mentioned the kidney, you mentioned the liver, so share a little bit about that, Tony. And then we'll close out.
The milk thistle is what, when you see somebody, they always talk about a liver cleanse and a kidney cleanse. You see them at the Whole Food, you see them at Sprouts, you see it at, you don't see it at Aldi's, but they got good prices on their vitamins, I tell you that. But the milk thistle is just good for a liver cleanse.
Okay.
The selenium is just good for your immune system. The B12 is good for your immune system, and
Ginger root.
Ginger root is great for your blood pressure. It's great for diabetes. It's like cinnamon. Cinnamon is excellent for diabetes prevention and controlling, helping to control diabetes. Now, the irony of it is, because I'm a nerd, but I look at a lot of like the History Channel. So they were talking about how did Saul and David and Cleopatra live to be 200 years old? And they didn't have insulin back then. They didn't have hypertension medication. So ginger root helps with high blood pressure. Like garlic. You know, I'm big with the garlic. So you know what? You know what they had? They had chili pepper, which helped with diabetes, which in turn helped with keeping the plaques from developing because of the pepper's intensity and helping your heart. They had willow trees and willow plants that the Indians used to eat willow because it had salicylic acid in it, which is what is in aspirin, which stopped toothache. So they also had cinnamon, where they, you know, where the medics or the pharmacists of that day, they used a lot of cinnamon on a lot of different stuff. Again, they had always had fresh fruit. You always see, you know, when you look at the Ten Commandments, my man Moses always was having a plate full of fruit around him. Pharaoh had food. You know, Nefertiti, she was sitting there with a big old bowl of papaya. So those different vitamins is what really helps. And it made so much sense to me when they talked about that darn cinnamon, because I take cinnamon. I was like, that, I think it was Dr. Trudeau. He was the big vitamin guy like 25 years ago. So I had his book, and he made that book so simple. And I think you can still get that thing for probably, I bet you can get that book for $2.50 now. But he explains a lot of the different, and you don't need to go over the top with anything. You just want to use stuff that makes sense to you. So these things make sense to me. And I take elderberry and emergence and zinc. So I think it's been a good thing for me maintaining my physicality. So I mean, I think it's just good. Now I still like to eat a little junk food, but for the most part, I eat a lot of fish and I eat a fair amount of chicken, but I don't eat much pork. I don't eat much red meat. I don't eat many hamburgers, but I love them. But you know, I choose to make that sacrifice. Whereas, you know, and I can still enjoy the other foods and the vegetables. I hope I answered your question. I got
No,
when
you
I get to
did.
talking about, you know, holistic health, it's real important that you stretch. It's real important that you drink water. It's real important that, you know, you put yourself to a challenge where you'll say, I'm not eating any red meats. I'm gonna eat soup and salads all week.
Okay.
No hamburgers, no junk food, no hoagies, no vegetarian hoagies, no vegan hoagie. but just do different things to change up. I'm a real big intermittent fasting guy, and I've been doing that before just because of my practice. I just never took time to. I go in, eat an apple in the morning, I might eat a plum. At lunchtime, I may eat some cheese crackers because I can't feel heavy. So when the drug reps come and they go take us to lunch, and when I come back, I'm ready to curl up and go to sleep. So when I get home, I eat me a nice meal. I can eat fish, and I like broiled fish or fish on the grill. I can eat a salad, and sometimes you can spruce it up with a little chicken. You can spruce it up with a little turkey. You can do a julienne with a little bit of ham, but you got to do everything in moderation. So
Thank you, Tony. Two more things. There's a question in the chat about the type of cinnamon you use. They have regular cinnamon or Ceylon cinnamon. That's the gummy one.
yeah, I think you can use any cinnamon, but I just get the one from. Well, we got a big vitamin company. We got a big vitamin company in South Carolina. So one of my patients, she loves me. So she brings me a bag of vitamins like this. Check this out. So I have to give them to my sons. I have to give them to my friends. So like I see her like 3 or 4 times a year, and she'll bring a big old box in there, and I give it to all the staff. They love it. So but vitamins are fairly inexpensive, so they can really be supportive.
Thank you for closing out the conversation for feet with physical health and wellness, because that's next month's topic. And we'll have James Chambers talk about physical wellness and our health. It's perfect. We need these healthy feet, and you showed the interconnectivity between all of it with our feet and how we need to take care of them. Tony, I can't thank you enough for sharing your wisdom, your expertise, and your generosity of your time with us. So thank you so much. And we're going to have you back. This is just part 1. I hope you'll come back.
Oh, you want me to come set my practice up in Richmond?
Oh.
Hey, man, my mom would be rolling over in her grave if Lisa got me to come back to Richmond. Oh, my gosh. She was like, boy, I told you.
I was trying to do that a long time ago, but this is great. So thank you so much for providing your perspective on vitamins and health and nutrition, and making us recognize the importance of our feet, our health in our feet, and what we need to understand about them. Thanks. All right.
Thank you guys for your time. And Mr. Studman, I'm looking for
Tony.
you to come down.
Yeah.
I'm looking for you to come down so we can play.
You
I'm
need to
heading
go
that way.
smack some balls.
I'm heading that way. Should I bring my foot jaws?
I got you, my man.
This is great. Thank you, everyone. Have a great evening. See you next month.
Thank you.
Thank you. Thank you. All right.
You too.
Yeah.
Have a great evening.